Welcome to CATAWBA Valley Medical Center, and thank you for choosing us for your procedural and surgery needs. The purpose of this virtual tour of the surgical suite is to acquaint you with our facilities and procedures before your visit. It's our hope that by watching this presentation, you'll feel more at ease when you actually arrive for your appointment. It should also be comforting for you to know that we have twice been designated a magnet hospital. Only 2% of hospitals in the United States have obtained this coveted achievement, which assures patients and their families that our nurses deliver the gold standard of nursing care. When you're driving to our day surgery department, enter the hospital grounds through the front entrance and continue to the right side of the hospital, following the signs pointing to day surgery. For your convenience, there is a separate parking lot for day surgery patients. From there, enter through the day surgery entrance. Take the gold elevator to the first floor. Your upcoming surgery or procedure was scheduled through the office of your healthcare provider, who is also responsible for scheduling your preoperative health assessment. Based on your provider's preference, you will either be fast-tracked, which is a telephone interview with one of our registered nurses, or you will be scheduled to come to CVMC for an assessment with a registered nurse in our day surgery unit. If you appear in person, please bring all your insurance cards. On the other hand, if you're going to be fast-tracked with a telephone interview, please provide all available phone numbers to your healthcare provider so you can be reached for the interview. Now let's assume it's the day of your surgery. Things you will want to bring along include your insurance cards, an updated list of all medications, and a pair of slip-on shoes such as flip-flops or bedroom shoes. Please do not bring any jewelry or valuables. It's important that you have nothing to eat or drink starting at midnight the night before. The reason for this is that food and beverage in your stomach could lead to aspiration or stomach contents rolling into your lungs. This can lead to serious complications, so for your safety, please honor this request. Your preoperative interview nurse or physician will advise you of any medications that need to be taken on the morning of surgery. The day of your surgery, check in with the receptionist, who will issue your family a pager. The purpose of the pager is for us to maintain contact with a family member while you're in surgery. Upon hearing a page, the family member should return to the reception desk to receive a message or perhaps meet with the physician for a surgery report. Once you are checked in, your nurse will arrive to walk you back to your day surgery room to prepare you for surgery. If you like, 2 family members or visitors may accompany you. If you are scheduled to be admitted to the hospital after surgery, please leave your suitcase in the car and have your family deliver it to your assigned room. Surgeries may be started early or possibly delayed, depending on what happens in the surgery suite. We apologize for any inconveniences that this may cause, but once again, every patient deserves our utmost attention. Let's assume your surgery time is scheduled for 10 a.m. You should arrive 2 hours before then to give your nurse time to complete all paperwork, start your IV, complete any last-minute tests or lab work that have been ordered, and re-educate you on the pain scale and comfort goal. All patients are asked to establish a comfort goal prior to admission to CVMC. There is also a level of discomfort that you could live with before taking something for pain. A scale of 0 to 10 is used, with 0 being none and 10 the worst pain you could imagine. You will be asked to rate your pain using this scale. It is also at this time that an anesthesiologist will come talk to you. When it is getting close to your scheduled time for surgery, your operating room nurse and the anesthesia provider will meet you in day surgery and take you back to the operating room, where you'll see lots of equipment, bright lights, and staff with masks and hats on. This is a very typical scenario. When you wake up from surgery, you will be in the post-anesthesia care unit. You will still be attached to monitors, so we can assess your status as you wake up. Family or friends are not allowed in this area, but you can enjoy pre-selected music from CVMC's menu or your favorite music from home. Once all criteria is met for you to leave the unit, You will return to day surgery to prepare for discharge home if you are not being admitted. There, you will be given a beverage, if allowed, and your family will once again join you. While you're in the post-operative area, we'll assess your pain and try our best to get you as close to your comfort goal as possible. Physician's orders will also be provided to both your caregiver and you. Plus, any follow-up appointments will be made and prescriptions written. Once all criteria have been met, you will be discharged home. But please remember that you will not be allowed to drive for 24 hours, and someone must stay with you for this time period. Before we leave this virtual tour, we want you to be aware of an acronym known as Speak Up. At CVMC, we believe in the points that are made by each representative letter in the acronym, and we encourage you to put these points to work when dealing with your health and healthcare. S. Speak up if you have questions or concerns. It's your body, and you have a right to know. P. Pay attention to the care you're receiving. Make sure you're getting the right treatments and medications by the right healthcare professionals. E. Educate yourself about your diagnosis, the medical tests you're undergoing, and your treatment plan. A. Ask a trusted family member or friend to be your advocate. K. Know what medications you take and why you take them. U. Use a hospital, clinic, surgery center, or other type of healthcare organization that has undergone a rigorous on-site evaluation against established state-of-the-art quality and safety standards. P. Participate in all decisions about your treatment. You are the center of your healthcare team. Thanks for watching. We look forward to your visit and appreciate you allowing CVMC to be your healthcare provider. Trust experience. Trust technology. Trust CATAWBA Valley Medical Center.